Welcome back to the channel, and please don't forget to subscribe if you're new to the channel. The application for a green card in the United States is a lengthy process involving numerous forms and appointments. A medical examination is a must in this situation. In this video, we will explain the importance of the medical exam and why it is essential to get it right. Let's get into the video. When applying for a green card, you must have a medical examination. The candidate suitable for citizenship in the United States of America is determined as part of the procedure. Adults and children seeking for a green card must undergo a medical examination. However, the metrics of evaluation are different for each age group. The candidate needs to get this examination done at their own cost and discretion. Medical professionals on the government's list of approved doctors are eligible to conduct the examination. What is the doctor looking for during the green card exams? Medical examinations for green card applications look different from a routine checkup with your local physician. During the medical exam, the physician's job is to screen the patient for certain diseases, preconditions, and vaccinations to ensure the overall fitness of the candidate for residence in the United States of America. Diseases that could disbar an individual from entering the United States include gonorrhea, Hassan's disease, or infectious leprosy, active tuberculosis, and syphilis at a contagious stage. In addition, if the candidate is seeking an immigrant visa, the disease list expands to any disease that require quarantine like COVID-19, coronavirus, smallpox, plague syndromes, and other conditions that can cause public health emergencies within the United States. If the candidate suffers illness that are not contagious or harmful to general population, they can be allowed entry into the country. This includes diseases like cardiovascular problems, cancer, mental illness. However, the candidate may be deemed inadmissible if they require government assistance due to a lack of personal medical insurance. Vaccinations for applying for a green card. USCIS policy manual comes with a list of vaccinations that the candidate requires before entering the country or applying for a green card. This is an updated list of the year 2021 of all required vaccinations: tetanus, pertussis, and so on. It is important to know that some of these vaccinations are age specifics. Also, the vaccination table can be updated based on information on diseases that become preventable by vaccination. Candidates should bring their vaccination reports as evidence of prior vaccination to the medical exam. The candidate must provide a full English translation of the vaccination sheet of the original document is not printed in English. Let's know what happens during the green card medical exams. The medical exam starts with the doctor matching the patient's identity with a passport or other official identity document. This is to make sure that the doctor examines the individual on the passport and not a healthier imposter. Next, the doctor checks the vaccination record of the individual. This checks ensures that the individual is up to date with all the required vaccination. The purpose of the checkup is not to provide a general assessment of the patient's health, but to ensure that they have met the medical criteria set by the United States Citizenship and Immigration Services before entering the country. The doctor or the medical staff will ask the patient to produce a medical history record during the appointment. The doctor will review the medical records to see the number of times the patient has been to the hospital, if they have been admitted to an institution for any mental illness or chronic physical ailment, and if the candidate has been involved in a severe accident leading to a sickness or disability and difficulty in returning to a normal state of functioning. The doctor will also question the candidate on their use of alcohol or any drugs. They can also ask about any history or harmful and aggressive behavior or psychiatric episodes that haven't been documented previously. The doctor could ask for previous police, military employment, and school records to find any plausible history and aggressive and harmful behavior alluding to a mental or physical disorder. These records can also reflect any disability or illness caused by traumatic events. Next, the hospital will take x-rays of the chest and draw blood samples and review other treatment records to check for tuberculosis. Physical examination includes the doctor checking the candidate's cardiovascular and so on, assessing if they have any symptoms of disease that make them, including the face, ears, eyes, nose, throat, heart, lungs, limbs, nose, skin, genital, other, and other on. It is essential to prepare for this medical examination. The candidate should talk to the doctor before the examination and refrain from eating to maintain the standard of the blood sample drawn. If the candidate is sick before the medical exam, they can go back to their doctor for treatment and defer their immigration medical examination. If the first medical examiner cannot decide the medical fitness of the candidate, they could be referred to another doctor for further testing. Once the test is done, the doctor fills out a form with the results and observations. This information is put in a sealed envelope and the results directly to the consulate and not to the candidate. Thank you for watching. Please subscribe to the channel. Bye.